sa inyong lahat.
I'm with Dr. Bigesh, Cardiologist of Naseem and Rabeeh, and of course our Filipino doctor, occupational med, Dr. Alvin. Ayan, meron silang magandang, bakit ako nandito sa likod? Kasi meron silang magandang sasabihin sa ating mga kabayan. This coming, kayo na nga, sa Dr. Alvin.
Yes po. Ayun, tama po yung sabi ni Admin Carlo. Sa January 24 na po, 2020, magkakaroon na kami ng libreng konsultasyon na naman dito sa Naseem Rabeeh Medical Center, Siring Road. A program para po sa mga kababayan natin. And what will this program be? We're going to do a CVD Scoring, of course with our very own cardiologist, Dr. Bigesh. We'll be doing free Lipid Profile, free fasting blood sugar. Pag-uusapan po natin ito with our very own Dr. Bigesh.
I'm Dr. Bigesh Nair, Consultant Cardiologist Naseem Rabeeh, Siring Road, Doha.
Yes, napakabait po niya. Okay, doctor, so we're going to ask you, especially now that it's really very cold, is there any relationship with the climate as of this moment along with the coronary artery disease?
Sakit sa puso is very common in winter climate. It is basically because when you come out of a warm area to a cold area, especially from coming from inside of a house to outside, you are exposed to cold winds, not only cold winds, but the cold weather. It results in narrowing of the blood vessels, especially the coronaries. Your heart rate will go up, there will be spasm of the blood vessels. So whenever there is spasm of blood vessels in already a known heart disease patient, what happens is the person will get angina or chest pain. So when there is chest pain, that usually will be in the center part like a heaviness which will be radiating towards the left upper limb, and some people may have associated perspiration also. Sakit sa dip is very common in winter artery disease cases. So people already who are on medications, especially for a heart disease, coronary artery disease or a heart attack patient, should be taking a flu vaccine or a pneumococcal vaccination also should be done at least once in a year.
Napaliwanag kagad ni Dr. Bigesh sa atin the relationship of having a cold climate here in Qatar ngayon, at the same time yung pagkakaroon natin ng sakit sa puso. Okay, but we're going to go back to Dr. Bigesh. Tanungin po natin siya kung ano ba yung coronary arterial disease. Now, if you have a coronary arterial disease, we're also going to ask him, paano natin madi-differentiate yan? No? Kung paano ko masasabi na, uy, sa puso pala yon, hindi pala siya gastric na problem, ano? So we're going to ask Doctor, can you please tell us, can you please define to us what is coronary arterial disease, and at the same time, its risk factors, and how can we differentiate the signs and symptoms that it is coming from the heart or not from any vital organs?
Sakit sa puso or coronary artery disease is a stage where the coronary vessels or the vessels which are supplying the heart is having plaques or atherosclerotic plaques which causes narrowing of the blood vessels, which is actually a lifestyle disease. People who have high risk factors like diabetes, hypertension, dyslipidemia or high cholesterols with a history of smoking and a background family history of coronary artery disease are very prone for this phenomenon or this coronary artery disease. We have to understand one important thing. The coronary artery disease is a spectrum. There are patients who come with acute heart attack which has to be differentiated from a stable ischemic heart disease or stable ischemic syndrome. Right, doctor?
Yes, doctor. I agree.
So people who has chest pain more than 20 minutes duration with radiation of pain to the left upper limb associated with sweating as well as radiation up to the jaw, up to the umbilicus. Lot of people don't consider, suppose you have a pain here, lot of people is a throat pain, but people having a risk factor definitely have to rule out a cardiac disease also. So that is very important. So whenever you get a chest pain in the center, radiating to the left upper limb, lasting more than 20 minutes, you have to come to the hospital and get a simple test known as electrocardiogram or ECG.
Once again, sa ulit just this 24, malapit na po. Come to us. We're going to start at 8 o'clock in the morning until 3 p.m. only in the afternoon. And you're going to see more of us, most especially with Dr. Bigesh.
Mabuhay po kayong lahat.
Yes.